this morning we're going to have an interesting conversation. This month is Child Cancer Awareness Month, and I think it's a very important topic for us to get into. I've been joined by Serwaa, Owusu, Ansah, and also Ernestina Schandorf. Now, Serwaa is the Programs Manager for World Child Cancer UK, and Ernestina Schandorf is a oncologist. Now, this topic is very vital because there's so many dimensions to this, and I think it's truly unfair for children to get cancer and all that. So let me introduce my guests to you. Good morning, ladies.
Good morning.
You're both welcome.
Thank you.
Yeah, now talk to us about childhood cancer. How is it defined? What is it? And why do children get cancer in the first place? Is there any reason?
Yeah, so childhood cancer, as the name suggests, is a cancer that's found in children. Okay, all over the world, children get cancer. And cancer is an abnormal growth of cells, whether it's cells from any part of your body. And anyone can get cancer. Adults get cancer, children get cancer. But unfortunately, a lot of us don't know that children can also get cancer. Unlike with the adult cancers, where maybe someone drinks a lot of alcohol, gets a liver cancer, or smokes a lot of cigarettes and gets a lung cancer. With childhood cancers, the cause is not yet known. Children are usually born with these defects through no fault of theirs. So childhood cancer is very common. Worldwide, we have about 300,000 children affected every year. Yes.
Wow.
And in Ghana, we're expected to get about 1,300 plus children every year. But we see only about 300 in both Kolebu and Konfanochi. That's like 30% of the total number. Meaning that 70% of these children are either home, don't know that it's cancer, or probably not even alive. Yeah, so childhood cancer is very, very important. And the fact that children get it is also important. With the presentation, usually the symptoms are not so specific. They can resemble symptoms of other illnesses. So we have an acronym we call the SILUAN, SILUAN. Okay, with the S meaning the symptoms that are persisting. So a persistent fever, your child's temperature has been high for more than 2 weeks, not resolving on anti-malarials, not resolving on antibiotics, you know that something is wrong. Or if the child is having weight loss unexplained. Then the I stands for eye symptoms. If there is a white spot in the eye, or if there's a squint, meaning that the eyes don't look in the same direction, or sometimes in the later stages you see the eye is swollen and red and enlarged. Then L for any lumps or swelling in any part of the body, from your head to your feet. Any lumps in the abdomen, hands, feet, you should know that you should send this to the hospital. Then the A, any aches or pains, especially if the children keep on complaining of bone pain, and the child is not a sickle cell patient, then you know that something is up. You should investigate. On neurological symptoms, maybe the child's walking has changed, the child complains of severe headaches, persistent vomiting, persistent nausea, or even the handwriting has changed. All those signs may be subtle signs that something is wrong and can indicate a brain cancer.
Wow. Now, what are some of the interventions that we can have is there a good success rate in treating this? Just take us a bit into that to understand what's going on.
Okay, so previously, as at 2010, the success rate was about 20% for the children who present at the facilities. But with some interventions, support, be it financial, training of the doctors, it's appreciated. Currently, we are not there yet. Globally, it's about 80%. But currently, we are around 50-45%. So we are making some good strides. And we think that if government comes on board with the NHIS support, we can make better strides. So what WCC is contributing currently is if the patients arrive at the referral centers, we take care of their diagnostics costs, we take care of their treatment costs, we give some transport cost reimbursement to the caregivers. We are equally supporting in training of the health professionals. Dr. Schandorf here is an example. Currently, we have about 5 doctors in training with the Ghana College of Physicians and Surgeons to be oncologists. And it's very, very disturbing that Countrywide, we have just 5 oncologists. Countrywide.
Wow. Are you serious?
Very serious.
That's a dire situation.
Very, very, very.
Wow.
So we coming in with training additional 5 will increase the number to about 10.
Okay.
But we need more than that.
Yeah.
And we've also started a program with the Ghana College of Nurses and Midwifery. Currently, we have no oncology nurse in country.
This is actually a very serious problem.
So we are supporting with training of oncology nurses. Okay. We are starting with 15 of them. It starts next month. So within a year or 2, we will have 15 oncology nurses. So these are the supports we are providing. And when the children get admission into the facility, they seriously can't go to school. The Ghana Education Service has teachers around who come to the wards to train the to educate the kids, which is very, very good. But we are also supporting in our small way. So we give them reading books, we give them some stationery, we give them crayon and all that. And the doctors at the ward have also developed this book, which are very, very simple to read. And it tells us about their story. So this was done by the doctors, and we supported in printing them. So these are some of the interventions World Child Cancer is providing through the government of UK and some other benevolent people.
What sort of like the ages we're looking at the hospital? What's the youngest child?
So with childhood cancer, because the predisposition is already there, you can have a child of day 1
with the cancer.
With the cancer, and usually with the cancers of the eye, they are commoner in the infants. So sometimes a mother will come, maybe a week. She noticed that there's a white dot on the child's eye, but it's painless. There's nothing wrong, so she may sit at home and she may not know that it's cancer. And by the time she comes, it might be too late. So it can start as early as 1 day of life, in the neonatal period, and as old as 18 years. And after 18, you have the adult cancers stepping in.
I want you to go, because earlier on you mentioned about some symptoms to look out for. I want you to reiterate those symptoms again. You talked about lumps and spots in the eye and so on. Can you give us all the different symptoms that parents should be looking out for in their children? So that in case they've seen some, of course, we know that if you see, it doesn't mean it's necessarily a cancer, but at least you can then make a step and move to the hospital.
So thank you very much. So as I said, we have an acronym, the SILUAN.
SILUAN.
SILUAN. So S stands for symptoms that are persisting. If it's a temperature which has lasted more than 2 weeks, or if it's weight loss has lasted more than 2 weeks, or your child is constantly looking very pale, very white for more than 2 weeks with no unknown cause, you should suspect that it could be a cancer. Or the I stands for eye symptoms. So a dot in the eye, a whitish spot in the eye could indicate that. Or when you take pictures of your children and you see cat eye reflex, like you see the whitish reflex, that could also tell you, because sometimes you may not see it with your naked eye, but when you take a picture, then the reflection will come, and then you realize that no, child has a whitish reflection in the eye through the picture. Or if the eyes don't look like a squint, one eye is facing one direction, the other eye is facing another direction, you should get a check. Or if it's obviously swollen or red, you should get it checked. Then A, the L, for any lumps or swellings in any part of the body.
So we're seeing some lump here.
Yes, so you see there's a swelling in the jaw. Usually it comes very fast for this type of cancer.
It develops really quick.
And it may be painless. So a mother will say, it's not paining him, so let's sit at home and watch and see. But then it's spreading, and cancers spread very quickly to any other parts of the body. So that's why it's very important that they present early. Once you see the symptom, don't sit at home, just present early. And I like to state that childhood cancers are curable. They are very, very curable. Outside in developed countries, the cure rate is 80 to 90%. Out of every 10,
which is a very high success rate.
And we can replicate it here. It's just that, unfortunately, the awareness is lacking, and that's why we go on these talks to increase the awareness. And also, the major problem is the financial problem on parents, because treatment of cancer is very expensive. averagely, to investigate a child for cancer, it may cost you like 2,500 Ghana cedis, which is quite an amount of money.
People, yeah.
Yes, so, and unlike for adult cancers like the breast cancers, cervical cancers, prostate cancers, which are covered by the insurance, childhood cancers aren't.
Okay.
So it puts...
They are not covered by NHIS?
They are not covered by NHIS.
Oh, wow.
So it puts more strain on the parents. And the children need similar medications to the adult cancers, just that in less doses. So we really plead with the government and the stakeholders to include it in the National Health Insurance Scheme so that people would come early and we can cure these children to live their lives. Once you are cured of cancer, you can live your normal life up to your 60 or 70 years that you have been given. So it's very, very important for us. And also with the treatment of childhood cancer, we need to investigate to find out there are different cancers. It can happen from your head to your feet. So you need to investigate to know the exact type of cancer it is. And these investigations can be quite expensive. Some may need scans, some may need blood tests, urine tests, and these are not covered by insurance. So parents need to pay out of pocket, which becomes very difficult to even diagnose in the first place before you can even start treatment. So we really plead with the stakeholders to include it in the National Health Insurance Scheme.
What are some of the other challenges that you find in the whole value chain of trying to get children investigated first of all, or when you find out they have a cancer, to get them treated? What are some of the challenges that you tend to find?
So one basic challenge is the health professionals at the periphery, the district hospitals, getting to know that, okay, this condition, I've gone through all the protocols, I'm not finding the exact details, so hence referral. Some of the kids or some of the children can spend as much as 3 months in the district hospitals or the CHIP compounds, and the results or the condition hasn't been diagnosed. But with childhood cancers, the earlier is diagnosed, the better the treatment. So what we are advocating for is that the health professionals at that level should know that if they are not really pinpointing the challenge, they should refer. And where we come in is currently we have in place a training program for all healthcare professionals. We are doing it regionally. So we are going around to the regions to train the primary healthcare workers on the early warning signs of cancer so that they can refer appropriately and on time to save the child's life. Another thing is that when the children are put on palliation, when they are determined palliative, most of the caregivers give up. But palliation doesn't mean that your child is dying. The child will go through a process, not a painful process, but will elongate the time of life God has blessed the child with. So what the doctors normally do is they counsel the parents that your child is going on palliation because it was presented late, but it doesn't mean that you have to let your child go and die. You have to make the child's life comfortable. So normally they give them a letter and some prescriptions of the pain relievers that if there is any episode, they should go to the nearest health facility for medical check. And that we are advocating with the parents to really make sure that their child goes through life successfully. And palliation doesn't mean it's a death sentence.
Final thoughts as we wrap up. Final thoughts.
So thank you very much for having us. And we would like to reiterate that childhood cancer is very curable and you just need to present early. So in as much as we know the symptoms as health workers, when we have challenges, let's refer early as soon as possible. And to the stakeholders and to the government, these are our future children. This is our future. We don't know who the next president is. And with childhood cancer, there is no socioeconomic discrimination. It can happen to a child in America, it can happen to a child in Ghana. So please, let's try and include it in the health insurance scheme so that to help all our children so that they can live their lives that God has given them.
All right.
And also, just to add that the little success we've chopped is as a result of the collaboration with other partners. ICGC Christ Temple is supporting very well. Lifeline for Childhood Cancer is doing its bit. Little Angels, Mofra Africa, and all that. So we say thank you to all the supporters.
And then also to the First Lady for helping us with the Mothers Hostel, where the parents stay. Usually it can take from as little as 6 months to 3 years for the treatment. So those who come from far need a place to stay. So the First Lady has helped us with establishing a Mothers Hostel for those who come from far.
Fantastic. Thank you very much. Thank you to you. We have been speaking with Serwaa, Owusu, Ansah, and Dr. Ernestina Schandorf, helping us to get into the conversation about childhood cancer. It's a very, very important topic for us to deal with, particularly because the issues of a child who's done nothing, to deserve this is dealing with this, very difficult condition. This segment, the health segment, has been sponsored by the Farmers Market. Farmers Market, 100% hygienic and farm fresh. They're supporting us, with Farmers Market has fruits and nuts and seeds and all those things, wonderful things.
Hi there. We hope you enjoyed the show.
Make sure to subscribe, like, comment, and share with your friends.
This is Breakfast Daily on City TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on City TV.